Hey guys, what's up? Welcome again to my channel. And as I promised you that I will make another video on which surgery you should be going with, which one will be more useful for you. So in this short video I am going to explain it, which one you should be going with. Now if you haven't watched my previous video in which I have described that whether you should be going for the surgery or not, and if you haven't watched it, highly recommend that you should watch that video first and then you should watch this video. Okay, fine. Now explain the laser procedures for your eye surgery. One thing you must remember that there are many of the procedures which are called as the rejected ones due to their low accuracy rate. So I am going to discuss only the major procedures which are highly encouraged in the market. Now talking about the type of condition that you have, on the first we have the myopia. Now in myopia, if you have high spherical numbers and less amount of stigmatic numbers, I highly recommend that you should go with the procedure known as smile. Biggest advantage of this procedure is that there is no incisions or cutting involved, but a kind of limitation which most surgeons have experienced, that whenever the stigmatic component is involved in these surgeries, smile procedure is not the best choice because you have to correct this cornea in the very best way, which is not quite possible through smile procedure. Now coming on to the second one, if you have a high stigmatic component in your prescription, I highly recommend that you should go for the LASIK surgery. It involves minimal incision, but for astigmatic procedure it is the best one, about -6 to -8 or something like that. You should be going with the LASIK surgery. It has a high accuracy rate in these procedures. Now going for the last one, if you have hyperopic component in your prescription and astigmatic number also, then the choice of surgery for you is the PRK, because it is the most recommended one for the hyperopic. LASIK even work, but if you check out the accuracy, in most of the cases PRK is the recommended surgery for hyperopic procedures. Now before concluding my video, that it is just for your general basic knowledge and it should not be taken seriously because it varies from person to person that which procedure you should be going for. Maybe you have some kind of disease, the cornea disease, the lens diseases. In my previous video I have told you that if you have any kind of disease, you should avoid these surgeries for now, and when these diseases gets resolved, then you should move on for the surgeries. Still I recommend, if you are going for the surgery and you have high budget and you are myopic, first preference should be smile, and after that if you have a stigmatic number, the best procedure for you is the LASIK, and the third one, if you have hyperopic condition, then you should go for the PRK. Don't look for their prices whenever you are moving on for the surgery, and surgeons give you option that it is a low cost method and it is a high cost method, and you are given the choice, then you must choose what's best for you. Already you are spending too much of a money, so it is highly recommended that you should spend a little more on it. I hope you have understand the concepts before moving on for the laser surgery, and still if you have any doubts, you can discuss your conditions and your prescriptions with me. I will highly appreciate that. For up to that time, like, comment, share, subscribe, and stay blessed.